At UPMC Sports Surgery Clinic, I work as a rehabilitation specialist. I have a particular interest in calf and Achilles tendon injuries, foot and ankle injuries, and general lower limb running injuries. And have had the opportunity to do a PhD in Achilles tendon injury rehab and lower limb biomechanics, which I completed last year. My background was a race walker, competed over 20 kilometres and 50 kilometres, and competed at the Beijing Olympic Games in 2008 and the London Olympic Games in 2012. And that led me down the road of biomechanics, working on and developing any weaknesses or deficits in strength or athletic qualities. My career in Olympic sports gave me that inspiration to pursue that side of things further once I retired from elite sport. I understand what it's like being an athlete, so I can understand the stresses involved, I can understand what it's like to be injured, and so I can feel I can use my own experiences to connect with the athlete better and hopefully find the right solution for them. Everybody's treated the same, regardless of their physical activity background and age profile. No two athletes are the same, no two injuries are the same. So we would do a good thorough assessment, assess their muscle strength, their power and plyometric ability, look at the running mechanics and what qualities they're lacking that might be relevant to either how they might have developed the injury or how they may be struggling to progress back to full training, and try and individualise their plan based on their individual needs, what the gym access is like, what equipment they have, and what time they can dedicate to their rehabilitation or strength program, taking into account their individual circumstances, their work demands, family demands, social demands, and not trying to squeeze too much in. There's going to be extra stress during exam time, and that might heighten the risk of injury. And getting the basics right, getting 7 to 8 hours of sleep a night and good quality sleep, having a good diet and making sure they're meeting their nutritional needs, and stress management. So we do try to make it fit to the person rather than trying to have a one-size-fits-all model. It's hard to prevent every injury, but we can certainly manage the risk of developing an injury or a repeat injury. So particularly during marathon season, we see a lot of running injuries that present in the last, say, 2 or 3 months before the marathon. And depends on the injury, but we try to get the athlete to the start line as best we can. Really fortunate to work alongside a wider multidisciplinary team of physiotherapists, fellow strength and conditioning coaches, biomechanics staff, research assistants, and our sports medicine consultants. And then within the wider hospital, radiology staff and consultant and orthopedic surgeons. So it really broadened my horizons, allows me to see the bigger picture when someone has an injury, and if there's a problem to be solved, be able to look far and wide to try and find that solution. And we have regular in-service workshops, and we learn from each other. Push all the way out. What gives me the most satisfaction? Getting patients better, whatever that takes. And even if I can't do it all myself, it's if we can. Sometimes it might be involving one of our sports medicine consultants, or maybe a colleague, particularly on some of those difficult, complex cases, and doing whatever it takes to find the right solution for them. And when they get to a point where they're back doing the things they want to be able to do and have overcome their injuries, that gives me a lot of satisfaction. Whether that's an elite athlete, whether that's someone who just wants to go back playing golf or walk their dog for half an hour every day, the principles are still the same. And seeing someone achieve a satisfactory outcome gives me a lot of satisfaction in my job.